This video will demonstrate the complete assessment and classification process for a child aged 2 months up to 5 years, and then for a young infant.
During the assessment, it is important for the health worker to establish good communication with the mother. First, the health worker welcomes the mother and asks the child's name and age. She asks the mother what the child's problems are. She asks if this is the first visit for these problems or a follow-up visit.
She speaks to the mother in terms she will understand and ensures that she understands the questions which are being asked. The mother is praised for bringing the child to the clinic.
The health worker is then ready to begin the assessment. First, she checks for general danger signs.
A general danger sign means that a child has a serious condition. This condition may require immediate life-saving attention, such as antibiotics by injection, oxygen, and other medicines which may not be available at the clinic. Therefore, a child with a general danger sign may need to be referred to hospital.
To check for general danger signs, first ask,
is the child able to drink or breastfeed? A child is not able to drink or breastfeed if the child is not able to drink at all. This child is not able to drink. A child not able to drink or breastfeed includes the child who is too weak to suck or swallow. This child is not able to drink. A breastfeeding child may have difficulty sucking when his nose is blocked. However, the child can continue to breastfeed when the nose is cleared.
ask,
does the child vomit everything? If the child tries to drink but repeatedly vomits and is not able to keep anything down, the danger sign is present.
next ask,
Has the child had convulsions?
a child with convulsions during this illness is not likely to be actually suffering from them when you see the child. Ask the mother if the child has had convulsions during this illness. Use terms she will understand. The mother may describe convulsions using words such as fits or spasms. If a mother reports convulsions during this illness, the general danger sign is present. Next, the health worker looks to see if the child is lethargic or unconscious.
A lethargic child is drowsy when the child should be awake and alert. The child will not look at the mother or watch your face when you talk. This child is lethargic. This child is lethargic.
I think the interesting finding in her is her inability to make eye contact. Juliana, can you try and get
The child may fail to waken when the mother talks or when you clap your hands.
She's not following Juliana.
Even a very young baby who sleeps a lot should respond to these sounds. If the child does not respond to clapping, shake the child gently.
Does not make eye contact.
An unconscious child cannot be wakened. He does not respond when he is spoken to or shaken. This child is unconscious. If the child is lethargic or unconscious, the general danger sign is present.
If any general danger sign is present, you should complete the rest of the assessment immediately, so there will be no delay in the child's treatment.
You will now practice identifying the general danger sign, lethargic or unconscious. You will be shown 4 children. After seeing each child, you should write down whether the child has the general danger sign, lethargic or unconscious. Check yes or no on the answer sheet. We will tell you our assessment after you have seen all 4 children. Here is the first child. Would you say this child has the general danger sign, lethargic or unconscious? Write down your assessment now. Here is the second child. Would you say this child has the general danger sign, lethargic or unconscious? Write down your assessment now. Here is the third child. Would you say this child is lethargic or unconscious? Write down your assessment now. Here is the fourth child. Would you say this child is lethargic or unconscious? Write down your assessment now. The first child was wide awake and alert. Therefore, the general danger sign is not present. This is the second child. This child could not be wakened. He has the danger sign, lethargic or unconscious. The third child appeared lethargic, but when attempts were made to wake the child, it awoke normally. Some children sleep very soundly, but can be woken. Then they are alert. They do not have the general danger sign, lethargic or unconscious. We decided that the fourth child was unconscious. The child did not watch the health worker or stir when attempts were made to wake her. Even though her eyes are open and moving, she makes no eye contact. Therefore, we decided the general danger sign is present.
After checking for general danger signs, continue the assessment by asking about the first main symptom. Ask,
Does the child have cough or difficult breathing?
if the mother replies yes, assess the child further.
A child with cough may have pneumonia or another severe acute respiratory infection. You must be able to identify the few children with pneumonia among the many children with coughs or colds.
If the child has a cough or difficult breathing, ask,
For how long? It's important to know how long a child has been coughing, as a chronic cough, lasting for more than 30 days, may be a sign of tuberculosis, asthma, or whooping cough.
Determining whether a child has fast breathing is an important step in assessing a child with cough. Fast breathing is a sign of pneumonia. Count the number of breaths the child takes in 1 minute.
When a child develops pneumonia, the lungs become stiff, making it more difficult to breathe. The child's breathing rate increases as the child's body tries to make up for lung stiffness and low oxygen. Because children's breathing rates slow down as they get older, the child's age must be taken into consideration when deciding whether fast breathing is present.
To decide whether a child has fast breathing, you will count the number of breaths the child takes in 1 minute and compare it with the following cut-off rates. If the child is age 2 months up to 12 months, the child has fast breathing if you count 50 breaths per minute or more. If the child is age 12 months up to 5 years, the child has fast breathing if you count 40 breaths per minute or more. The child who is exactly 12 months old has fast breathing if you counted 40 breaths per minute or more.
We will now watch while the health worker counts the number of breaths this 7-month-old child takes in 1 minute. Look for the breathing movement anywhere on the child's chest or abdomen. If you are not able to see this movement easily, ask the mother to lift the child's shirt. The child should be calm when you watch the child's breathing. If the child starts to cry or becomes upset, ask the mother to calm the child again before counting. The health worker is now ready to start counting the number of breaths in 1 minute. You may practice counting with her. We'll tell you when to start and stop counting. Select an area on the child's chest where you can see breathing movement. Prepare to start counting. Start counting now. Stop counting. How many breaths did you count? The health worker counted 90 breaths per minute. Since the child is 7 months old, he does have fast breathing.
Next, look for chest indrawing.
This child has chest indrawing. Chest indrawing occurs when the effort required to breathe in is much greater than normal.
To look for chest indrawing, you must know when the child is breathing in. When the child breathes in, the upper chest and abdomen move out. Breathing in, breathing out. Breathing in, breathing out. Breathing in. This is a healthy child with normal breathing. When the child breathes in, the upper chest and abdomen move out. The lower chest also moves out. This child has chest indrawing. When the child breathes in, the upper chest and abdomen move out, as in the healthy child, but the lower chest moves in. Chest indrawing is this inward movement of the lower chest wall when the child breathes in. Look again. Breathing in, breathing out. Breathing in, breathing out. Breathing in. When the child breathes in, the upper chest and abdomen move out, while the lower chest moves in.
Now look for these movements in some children. Look for chest indrawing when the child breathes in. This child has chest indrawing. The lower chest wall goes in when the child breathes in. This child has chest indrawing. Chest indrawing is only significant if it is present all the time and definitely visible. This child is breastfeeding. If you see chest indrawing only when a child is upset or trying to feed, but not when resting peacefully, do not call it chest indrawing. This child only has chest indrawing when feeding. Therefore, we would not call it chest indrawing.
Next, look and listen for stridor. Stridor is a harsh noise made when the child is breathing in. It sounds like this.
Look to see when the child is breathing in. And then, since the noise may be difficult to hear, listen for stridor by placing your ear near the child's mouth. Breathing in, breathing in, breathing in. This child has a harsh noise on breathing in. This child has stridor. If a calm child has stridor, the child is in danger of a life-threatening airway obstruction. Sometimes you will hear a wet noise if the nose is blocked. Clear the nose and listen again. Or you may hear other noises when the child breathes out, such as wheezing. These are not stridor.
Often, a child who is not very ill will have stridor only when the child is crying or upset. So be sure to look and listen for stridor only when the child is calm. That completes the assessment for cough or difficult breathing. In this section, we will practice counting fast breathing and identifying the presence of chest indrawing and stridor. First, we will practice counting the number of breaths in 1 minute for these two children. In each case, you will be given the age of the child and then asked to count the number of breaths in 1 minute. You should write down the number of breaths you count and then decide whether or not the child has fast breathing. You will be told when to start and when to stop counting. After 1 minute, this symbol will appear on the screen, and there will be a pause. You will have time to write down the result of your count and to decide if the child has fast breathing. Here is the first child. His name is Mano. He is age 4 years. Prepare to start counting. Start counting now. Stop counting. How many breaths did you count? We counted 65 breaths in 1 minute. Mano is age 4 years. The cut-off for fast breathing is 40 breaths or more. Therefore, we decided that Mano has fast breathing. Here is the second child. His name is Wumbi. Wumbi is age 6 months. Prepare to start counting. Start counting now. Stop counting. How many breaths did you count? We counted 66 breaths in 1 minute. Wumbi is age 6 months. The cut-off for fast breathing is 50 breaths or more. Therefore, we decided that Wumbi has fast breathing.
In this section, we will practice identifying the presence of chest indrawing in 5 children. Here is the first child. Her name is Mary. Does Mary have chest indrawing? What did you decide? We saw normal breathing. As the child breathed in, the whole chest wall and abdomen moved out. Therefore, we decided that there was no chest indrawing. Here is the second child. Her name is Jenna. Does Jenna have chest indrawing? What did you decide? We saw indrawing movement in the lower chest wall here, while the rest of the chest and abdomen were moving out. Therefore, we decided that Jenna does have chest indrawing. Here is the third child. His name is Ho. Does Ho have chest indrawing? What did you decide? We saw indrawing movement in the lower chest wall here, while the rest of the chest and abdomen were moving out. Therefore, we decided that Ho does have chest indrawing. Here is the fourth child. Her name is Anna. Does Anna have chest indrawing? What did you decide? We saw normal breathing. As the child breathed in, the whole chest wall and abdomen moved out. Therefore, we decided there was no chest indrawing. Here is the fifth child. Her name is Lo. Does Lo have chest indrawing? What did you decide? At first, it wasn't clear whether this child had chest indrawing or not. Because it wasn't clear whether this child had chest indrawing, we looked at the child from another angle. We then decided she does not have chest indrawing. If you are not sure, decide it is not chest indrawing. In this section, we will practice identifying those children with stridor, amongst several who have a simple cold or other respiratory noises. We will be assessing 4 children. Here is the first child. His name is Petty. Look and listen to his breathing. Does Petty have stridor? What did you decide? We heard a harsh noise when Petty was breathing in. Therefore, we decided that Petty does have stridor. Listen again. Here is the second child. Her name is Helen. Look and listen to her breathing. Does Helen have stridor? What did you decide? We heard a harsh noise when Helen was breathing in. Therefore, we decided that Helen does have stridor. Listen again. Here is the third child. His name is Simbu. Look and listen to his breathing. Does Simbu have stridor? We heard a wet noise when Simbu was breathing in and out. Therefore, we decided that Simbu did not have stridor, but a blocked nose. Listen again. Here is the fourth child. His name is Hassan. Look and listen to his breathing. Does Hassan have stridor or another sound? We heard a wheezing sound when breathing out. Therefore, we decided that Hassan did not have stridor. Stridor is a harsh sound on breathing in. This child has wheeze when breathing out. Listen again. That completes the exercises for assessing breathing rate, chest indrawing, and stridor. You will now be given the opportunity to practice what you've learned so far with an actual case study. Ben has been brought to the clinic by his mother. Ben is age 7 months. He weighs 6 kilograms and his temperature is 38.5 degrees. His mother says he has been coughing for 2 weeks. First, check the child for general danger signs. The mother says that Ben is able to drink, is not vomiting, and has not had convulsions. Look at Ben to see if he is lethargic or unconscious. Write down your assessment. Does Ben have any of the general danger signs? Now, assess Ben for the main symptom of cough or difficult breathing.
Does the child have cough or difficult breathing?
Ben has a cough. Therefore ask,
For how long?
Ben has been coughing for 2 weeks, and the cough is getting worse. Count the breaths Ben takes in 1 minute. Prepare to start counting. Start counting now. Stop counting. Write down the number of breaths you counted and decide whether Ben has fast breathing. Now, look for chest indrawing. Write down whether chest indrawing is present. Assess Ben for stridor. Look and listen now. Write down your assessment. That completes the assessment process for a child with cough or difficult breathing. You should now use the signs to classify the illness. Look at the section of the classification table for cough or difficult breathing. Choose the appropriate classification for Ben and write it down. We will now tell you our assessment and how we classified Ben's illness. Ben is age 7 months. His mother told us that she brought Ben to the clinic because he has a cough. First, we assessed Ben for general danger signs. Ben was able to drink. He was not vomiting, and he did not have convulsions. Ben was not lethargic or unconscious. Ben does not have any general danger sign. What did you decide? Next, Ben was assessed for the main symptom, cough or difficult breathing. Ben had been coughing for 2 weeks. We counted 55 breaths in 1 minute. As Ben is age 7 months, he has fast breathing. Ben has chest indrawing. We could hear no harsh sound as Ben breathed in. Therefore, we decided that Ben does not have stridor. Ben has a cough, fast breathing, chest indrawing, and no stridor. We use these signs to classify Ben's illness on the classification table. Look at the signs listed in the pink row. Always look first at the top, pink row. Ben has chest indrawing. Therefore, we classified Ben as having severe pneumonia or very severe disease.